So whether it's hip arthritis or knee arthritis, we always recommend that patients exhaust non-surgical options before considering joint replacement surgery. Non-surgical options are things like weight loss, over-the-counter medications like Tylenol and anti-inflammatories, physical therapy, injections. Cortisone injections into the hip joint for many patients can relieve the symptoms substantially and allow them to continue to function and do what they need to do on a day-to-day basis. So non-operative measures are certainly the mainstay of treatment. It's only after those things have failed that we start considering joint replacement. There have been a number of studies linking body weight to osteoarthritis, so we do think that there's an association between weight and wear and tear on the joints, which is why we recommend weight loss for a lot of patients. Weight loss can not only help with the symptoms, but it's possible that it could potentially reduce the amount of wear and tear on the joint over time as well.